Hello everybody, my name is Lily Ritter and I'm going to be presenting on multiple myeloma today. So first we're going to do a quick description of what multiple myeloma is. Multiple myeloma is a cancer of the plasma cells that begins in bone marrow. Multiple myeloma accounts for about 1% of all cancers today, and there are currently upwards of 24,000 cases in the US. It is the second most common blood cancer. The first is lymphoma, but just because it's less common does not make it less severe. Multiple myeloma actually has two types of phases. The first type is smoldering. Smoldering is when the disease is so early that there is no symptoms. In the active phase of the disease, that's actually separated into three separate stages. As the stages increase, so do the number of cancer cells in the body. And as the stages increase, factors such as hemoglobin levels, bone damage levels, blood calcium levels, monoclonal immunoglobulin levels become more severe and more obvious. All right, multiple myeloma is a very serious disease that exemplifies why the demand for plasma donations is an essential topic in healthcare. Second, we're going to talk about some causes for the cancer. So the exact cause for multiple myeloma, as is the case with most cancers, is not exactly known. However, the development of the disease is very well researched. So multiple myeloma develops the same way all cancers do. It starts out with a small group of cancer cells that multiply and multiply until they become a big issue for the body. These cancer cells crowd out the healthy cells and produce abnormal M proteins rather than helpful antibodies that cause complications all throughout the human body. And next we're going to talk about some risk factors. These are factors that can put you or anyone at a higher risk of developing the cancer. So first up, there's age. As you age, the older you get, the more likely you are to develop the disease. The single age group that is diagnosed the most with multiple myeloma is people of 65 years of age and above. Okay, for the next factor we're going to talk about is going to be race. People of African American race in the United States are going to be twice as likely to develop multiple myeloma than white Americans. In regards to sex, males are about slightly more likely to develop the disease than females, and a family history of the cancer can make someone more likely to develop it as well as being obese. That can also increase someone's likelihood of developing the disease. It should be noted that most cases of the cancer develop from MGUS. MGUS stands for monoclonal gammopathy of undetermined significance. It's a condition in which abnormal proteins are formed in the bone marrow. It's very similar to the cancer itself, but the cancer develops from that disorder. So next we're going to talk about some symptoms that the cancer causes in the human body. First up is a weakened immune system, which means that there's going to be more infections and a weakened ability to fight those infections, increased fatigue, excessive thirst, digestive issues like nausea and diarrhea, bone issues like weakened bone and bone pain, meaning that it'll be easier to break bones, kidney issues like reduced kidney function and increased urination, as well as comorbidity with anemia. So next we're going to talk about some treatments for the disease. The two more severe treatments for the disease are chemotherapy and radiation therapy. Next up, we're going to talk about biological therapy, which is also known as medication therapy. That's one of the treatments for the disease that have had recent developments. A good example of that medication is going to be interferon. Interferon works by stopping cancer cells from growing and multiplying. It also stimulates the immune system by encouraging healthy disease-fighting cells to attack cancer cells, and encourages cancer cells to send out chemicals that attract the immune cells to them. Another treatment that I should mention is plasmapheresis. Plasmapheresis is also known as a plasma transplant. It should be noted that This is not a cure to the cancer, but it does help lessen the patient's pain and the severity of their symptoms. Another treatment that's very important to multiple myeloma patients is bone marrow transplant or a stem cell transplant. This is meant to replace stem cells in the patient's body that were lost after experiencing one of the more severe treatments for the cancer, like radiation therapy or chemotherapy. So next up, we should talk about plasma. First up, we're gonna talk about what it is. Plasma is liquid blood, excluding the cells and platelets. Plasma is mostly made of water, but it also has a small percentage of vital proteins and an even smaller percentage of mineral salts, sugars, fats, hormones, and vitamins. To be more specific, about 55% of our blood is plasma, and the remaining 45% are red blood cells, white blood cells, and platelets that are suspended in the plasma. Although plasma is a part of blood, this explanation that I just went over is also explains why plasma donation is a bit different than regular blood donations. Plasma's very important four functions in the human body are helping maintain blood pressure and volume, supplying critical proteins for blood clotting and immunity, carrying electrolytes such as sodium and potassium to the muscles, and helping to maintain a proper pH balance in the body, which supports cell function. Next up, we're going to answer the question of why someone should donate plasma. Multiple myeloma and many other blood diseases like it are treatable with plasma-based treatments like plasmapheresis. Not only that, but other physical ailments like trauma, burn, shock, severe liver disease, multiple clotting factor deficiencies, immune deficiencies, and bleeding disorders can be treated with plasma-based treatments. It's important to note that anyone can donate plasma, but type AB's blood owners are actually the universal plasma donors. If you're interested in how you can be a plasma donor today, I included a link to a local plasma donation center website on slide 9 of my PowerPoint. Go ahead and check it out. Thank you for watching.